Hello friends, welcome back. Today let's discuss about vitamin B1. Vitamin B1 is also known as thiamine or anti-beriberi factor. Anti-beriberi factor. So what are the sources? The sources are food grains, that is cereals, unpolished rice, this is very important, unpolished rice, yeast and whole wheat flour. Now moving on to recommended daily allowances. So the RDA for vitamin B1 is 1 to 1.5 milligrams per day. So what are the important functions of vitamin B1? Let's discuss. So the main role in case of oxidative decarboxylation reactions. Oxidative decarboxylation reactions. Thiamine pyrophosphate is acting as a coenzyme in reactions like pyruvate to acetyl-CoA by the enzyme PDH. So this PDH requires thiamine pyrophosphate as a coenzyme. Next, alpha ketoglutarate to succinyl-CoA. So the enzyme alpha ketoglutarate dehydrogenase requires thiamine pyrophosphate as your coenzyme. Next, third, for trans-ketolase reactions, trans-ketolase in HMP shunt pathway, thiamine pyrophosphate acts as a coenzyme. So these are the three main functions of vitamin B1 in oxidative decarboxylation reactions: pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase and trans-ketolase reactions. Okay. Now what happens if we don't take adequate quantity of vitamin B1 in our diet? It leads to what is known as thiamine deficiency. So this can be classified into 4 subclasses. Okay. Wet beriberi, dry beriberi, infantile beriberi and cerebral beriberi. So wet beriberi mainly will have all the CVS symptoms like palpitation, breathlessness, heart failure, edema and heart failure. Okay, next in dry beriberi will have all the CNS manifestations. CNS manifestations like peripheral neuritis and paralysis. In infantile beriberi there will be restlessness and sleeplessness. In cerebral beriberi, which is also known as Wernicke-Korsakoff syndrome. So how to remember the manifestation of cerebral beriberi? You remember GOA. Global confusion, ophthalmoplegia and ataxia. Okay. So in Wernicke-Korsakoff syndrome we have global confusion, ophthalmoplegia, ataxia along with psychosis. Okay. Now what happens in alcoholics? In alcoholics, when you take alcohol, this is going to inhibit your intestinal absorption of vitamin B1, which leads to thiamine deficiency. So if thiamine is deficient, there will not be the coenzyme thiamine pyrophosphate. So pyruvate to acetyl-CoA will not happen. Okay, because this reaction is dependent on TPP. So this reaction will not happen because TPP is not there, because there is thiamine deficiency. So what will happen? More and more pyruvate will accumulate. So this increased pyruvate will be converted to your lactate. So pyruvate will be converted to your lactate, which will lead to lactic acidosis. Okay. So how will you diagnose vitamin B1 deficiency? Obviously the first thing is your blood thiamine level will be low. Blood thiamine is low. Next, your RBC transketolase activity. RBC transketolase activity will be low. This is the earliest sign of vitamin, earliest marker or test to detect vitamin B1 deficiency. Okay. Thank you. If you have any doubts, please post it in the comment section. Thank you.